All right, I hope you all can hear me.
I can hear you, Mark Kalispell.
All right, excellent. I'm gonna try to get us rolling here. We're gonna have to get the right computer going here. It's over here. Oh, great. Now I can close Prezi. Nice job. Give me just 1 second. Fire it back up here. All right, we're getting close, guys. All right, so can you guys see my screen here?
Yeah, I can see it.
Excellent. All right, well, we'll get started. Sorry about the rough start. I just want to give everyone an update here, as we've been doing every week, on the situation with COVID-19 and the situation at Dayspring Restoration. And as I sent an email out just a little bit ago, give an opportunity for folks to ask any questions they may have about the situation that we're in right now. So what is the situation that we're in right now? For those of you who've not been to this dashboard, I'm sure many of you have. Here's where the situation is right now in Montana. As of, this actually may be yesterday, but as of very recently, it may be the 15th. I don't think this is today. There was 11 new cases in Montana, which brings the Montana count up to 415 total cases. There's been nearly 10,000 folks in Montana who've been tested for COVID-19. And taking the 415 cases in the 10,000 that have been tested, we can see that there's about 4% of folks who are being tested who are coming back positive, which is really interesting, considering that we expected that there would be a much higher percentage of people who were in that suspect category who would be coming back positive. Frankly, based on the information I was getting in various industry-related roles here, about a month ago, there's a couple of things that are really different that we're seeing as an experience versus what we had feared would be the case. And so this is really good news for us in our state and in our communities. Originally, we were told that we would perhaps see the number of cases in the general population being as high as 70% if the social distancing practices were not put in place, and that if we did the social distancing, that maybe we would be able to get that down to around 30%. That was going to be the massive reduction that we would have by social distancing. So if you use those numbers, we would expect to see a total number of cases in Montana without social distancing of around 700,000 if you take 70% of our 1 million population. And then with the social distancing, if we were able to massively reduce that down to like 30%, we would see 300,000 cases. So what we're seeing here from an experience standpoint is something that is far less than our worst fear. So that is really, really good news. I'm just going to pause for a second here to mute everyone. We still have a couple people maybe who've taken themselves off of mute. So if you've taken yourself off of mute, please put yourself back on mute just so we don't get the feedback. Back to the news here. We can remain a little bit, or we can look at this with maybe a little bit of optimism, because if we're seeing that in that very, very suspect category of people, which would be around 1% of our population at 10,000 total tests that have been taken, my expectation would have been that that percentage of people who have been sick and have qualified for the test, that number would have been really high, that we may have seen those numbers, in the 80 or 90%. having only 4% of those people come back positive and only 415 cases by now, which we were projected. I've seen a lot of different projections, but seeing projections that maybe our peak would be sometime around the third week of April. Things look like they may be better than what we thought they might be. So this is really good news, and something I think in the midst of all the doom and gloom that we've faced with this, something that is positive for us to see. We'll continue to monitor this situation. If we look here at this little graph over here, we can see maybe that and again, I'm sure probably a lot of people have done this, maybe if we look back here at the very end of March, maybe the peak for Montana was somewhere around there. But clearly, we're not out of the woods yet, so we'll remain optimistic, but continue to abide by and continue to work within the place that we've been for a while, which is that we have to be very, very diligent within our organization and in our communities to continue to abide by the practices that we've had in place for a while, which include all those things in that nice little poster that Grace put together here about 6 weeks ago, which again, I know everybody's tired of hearing about this, but we have to do those things that seem maybe to some people a little silly, but they're really important. We have to make sure we wash our hands religiously, follow the good practices. I got to remind myself about this. I have to remind myself to wash my hands, be careful about touching your face, try to minimize the spread, and practice these social distancing things that are hard. They're not intuitive. So keeping that 6 feet of space is really important. Keeping our offices disinfected is really important. I know a lot of people are tired of doing that, but I just want everyone to hang in there and keep those practices that we've had in place for a long time now. Keep those in place. Better for us to be safe than to have someone needlessly get infected. We also are going to continue to use PPE on our job sites. I was really not sure how this would be received, but I actually had a customer call me yesterday who just said, man, I really appreciated your company when you guys came into my house having PPE. You know, it's a little strange, but man, it just made us feel really safe. So that's really important. We want to keep these things in place, and we'll continue to update you as to how this will continue to play out over time. But for the time being, we're going to continue to keep those practices that we've now had in place for a while in place and abide by them. Now, the other aspect of this is, how does this affect our business? Well, it's no secret to anybody. This has really had a profound impact on our business. There's a great reduction in claims, and there's nothing we can do about this. Folks who are staying in their homes are not having maybe claims happen as frequently because they're able to catch things early and maybe even mitigate their own damages. And they probably aren't comfortable with having people in their homes right now. So this has definitely had an impact on claims. We're definitely slow. But the good thing about our business is that in good economies and bad economies, people still have disasters. It's very slow. We obviously look forward to when things get back to normal, but we're not quite there yet. And we try to keep people as busy as we can through this challenging time. Now, one of the things that I guess I do see as a positive compared to maybe some other states. I have a friend who's in a state where they have not only the shutdown, but they also have said construction is not an essential function. And so unlike Montana, which has said construction continues to be essential and can continue on, these guys are in really bad shape because they not only don't have very much mitigation happening, but they can't do repairs. So I am thankful that we continue to be able to do repairs, again, following safe practices and procedures, because it keeps our people busy and keeps them in a place where they have jobs. So that's where we're at right now. And, you know, it is definitely slow, but we look forward to when that stuff starts to turn, hopefully, as things get better. I want to just have a big recognition. While we are slow, one of the things that we've been thinking about is we might as well help some people in our community while we're slow. And we'd had a number of folks reach out to us with various municipalities. We've had calls from ambulance services. We've had calls from fire departments and sheriff and police departments saying, well, inquiring to find out if they could have their vehicles disinfected. And they've asked us what, you know, it would cost to do that. And it's really tough, because doing this service for the communities is hard, because on a one-off basis, because setting up and taking down just to do a few vehicles would be really tough. And so we came up with this thought and this idea that we could perhaps, if we could centralize them all to one place, that we could efficiently do this and really just do it as a service to the community. So this is something we're doing in all 6 branches, and we're not charging any of the communities anything. This is just something that we're doing as a service to our community in this time to help them. And so really cool to see how this partnership we, of course, are doing with Murdoch's. Those guys are friends of ours, and they've provided their parking lots for us to use today, Kalispell tomorrow, Missoula. Got some cool video footage here. Well, we aren't going to be able to show the video footage, but got some great photos. Got some from Lindsay, got some from Tim Malone. Some others may have sent them too. Just neat to see. And so thanks for those who are out there doing this service to the community. We were able to serve ambulances. I don't have a total count on how many. I do know that we had some long lines of people waiting to do this or waiting for their vehicles to be treated. We had sheriffs, we had fire departments, ambulances, and really just a neat way to help out the community there. So really want to have special kudos to the folks who participated in this: Jeb, Sean, Brian, Logan, Tim, Jerry, Lindsay. Sorry, Lindsay, I just realized I spelled your name wrong. It's Lindsay with an E, not Lindsay with an A. So sorry about that, Lindsay. Lindsay was really instrumental in helping get the word out on this. Grace also helped here from Bozeman to help spread the word on this. And I think Chris was actually even in some of the photos. So I wasn't able to tell. He doesn't have like any you know, duct tape on his suit saying this is Chris, but I'll take his word for it that he was actually out there helping out. But anyway, great job, team. Again, Missoula tomorrow, and then I think it's Butte on Monday, Helena on Tuesday, and then Bozeman on Wednesday. I might be off a day in there, but we're going to try to just offer this to the whole state and help out there. And then ultimately, there is no Murdoch's in Great Falls, but we're exploring right now a partnership potentially with one of the hospitals up there. So we'll want to make sure that we treat the folks in Great Falls and take care of those first responders up there as well. Of course, the first responders, one of the reasons this is important is that they have people in their vehicles. You think of ambulances that may have COVID, police cruisers, or sometimes after someone's apprehended, they have someone in their vehicle. And then, of course, fire trucks are going in and out of it, dealing. A lot of those guys are paramedics. So something that we wanted to give them a little peace of mind. They've been asking about it in a way for us to help out and participate in the community. So thanks to everyone for that. Now, one of the other things I wanted to address here in our time today is really just to clarify some of the things that we talked about last week. And you know, this is something we were pretty sure that we were going to have to deal with, and maybe we won't. I mean, I still think it's possible, but maybe we don't have to deal with a situation where we have someone on our staff or someone in our community, in our company, who's impacted and test positive for COVID-19. So I had mentioned, I think caused some people some angst last week, that we would how we would deal with this situation based on guidelines from the CDC. And so I just wanted to clarify that. Again, we may not even have to deal with this situation, but in the event that someone does get infected who's in our organization, whether there's someone from the field or from the office, we know that they're going to probably have questions about, if in the event I get this, what happened? Like, how do I come back to work? So what we'll be following are just the guidelines that we have from the CDC. I'm going to ask Grace or Jody put these up on Bamboo just so you have it as a resource. Okay, but this is just directly from the CDC. I hope nobody gets COVID-19. I didn't think 30 days ago. I will tell you, like probably everyone in our country, I thought that we were going to have probably half of our company that would get this at some point that would be positive. I mean, based on those 40 to 70% numbers that we were hearing. But the numbers seem to be way lower. So maybe we will be lucky. Maybe we won't have people that get COVID-19, but it's still pretty likely that someone will. So what happens if we do? Of course, what everyone already knows is what you should do if you get it. Now, the hard part about here, and this is really from page 2, you guys can look at this, how to discontinue home isolation. What we really wanted to just share with people is information. If you do get it, how would you ever get back to work? So last week we talked about this. If someone does get it, they will need to, once they've tested positive, they'll need to self-isolate or have home isolation. But we're not going to close our branches, right? I know that some businesses, someone's tested positive and they just close down the branch, send everybody home. I continue to be clear with everyone, that's not how we're going to address this. But if someone does get it, how do they ever get back to work? Everyone's going to handle the situation probably a little bit differently, but if they do have it, and the reason I say they're going to handle it differently is because there's been a huge, really variation of how people actually, the symptoms that they experience and how they react to it. So some people have it and it's very severe. Some people have it and they're like, man, it was really, really mild. So clearly the individual situation is going to dictate how it's handled. But in the case if someone does get it mild, there's really only 2 ways that someone can get back to work. And again, I hope this isn't even an issue. We may not even have to deal with this. But it's pretty likely still that we will. But there's 2 ways that we deal with it. One way is that you can get multiple tests to be able to dictate that you get back to work. I think this is super unlikely. People are having a hard time to get a test even if they think they have it. So having 2 negative tests, which is this, I'm going to use my cursor just to show, if you have 2 negative tests, that's this section right here. So we're probably going to be working in this case right here is, how do you discontinue home isolation? And when would it be appropriate for you to get back to work? And it's probably going to fall into those bullet points there, which say this. It says, you can't have had a fever for at least 72 hours without any medicine use before you get back to work. So if you've had a fever and you're taking medication that's artificially lowering the fever, that doesn't qualify for return to work. If you do have at least 3 days, 72 hours, where you've not taken any medication, that would be one criteria. Okay, now the other ones is your other symptoms would have to improve. That's bullet point number 2. Your cough and shortness of breath would have to be better, which again, some people have not even had that symptom. They've had very minor symptoms. So if you have a cough and you have shortness of breath, you couldn't return to work, okay? So that has to improve. No fever for 3 days, at least 3 days. And then the third one is at least 7 days have passed since your symptoms first appeared. So you would, let's just say that your symptoms appeared on a Wednesday, 7 days after that, if the other criteria were met, then you could consider being back to work. Again, these are going to be for the cases for people that have relatively low levels of this or minor cases. If someone has a more severe case, if that did happen, God forbid, it's going to be a little bit different. But those are the guidelines from CDC. That's what we will be using. We're not going to make up our own rules about this. We're going to try wherever we can to use the CDC guidelines because that's where we have the science and the medical experts who are able to speak to this. So I hope that clarifies. I mentioned last week we would give more information this week and that we'd be looking for this guidance. So this is what we're using. If other information becomes available, just like a million times, we've had so much new information, these things sometimes seem to shift around. If other information becomes available, then we'll use whatever the most current guidance we have from CDC. And again, I'll just ask Grace to put this up on our website, or the Bamboo HR, so that everyone has it. If you have questions, a good resource. CDC has tons of resources. And if you have concerns about this stuff, if you feel the symptoms and so forth, that's a good place to go. So that is all of our content that we had for today. But as I mentioned too, and I want to show one more picture. This one here, I kind of got at the end from Grace. I just thought this is a great picture. Here we've got, the Murdochs in the background, their garden center, and our large loss trailer, and a couple guys, I'm not sure who they are, working on this police emergency response vehicle. And here we have our officer over here just patiently waiting. I think it was about somewhere between 4 and 10 minutes per vehicle that we were able to really efficiently disinfect these vehicles. So again, thank you to everyone who participated. We hope that we'll have many, many more that we can address over the next number of days as we treat the other locations as well. If you have any friends or family or anyone that is in an emergency response capacity, feel free to pass the word to them. One of the questions we had were, what if you're from an outlying area of one of our locations? And that's totally fine. We're happy to help anyone who's a first responder. So if that's appropriate, feel free to pass that along. So those are the things that we wanted to share here today. We do have about 5 minutes, just checking in on my time. I don't want these to be long, burdensome meetings, but cover as much information as we can, as quick as we can. So we do have about 5 minutes left. If anyone has questions, maybe you've had a chance after I sent my last email out to kind of think of some things maybe that you want to bring up. I'll try to tackle those if anyone wants to take themselves off of mute and ask a question.
Hey, Mark, this is Andy.
Andy, yes, sir.
Hey, I had a question, especially given your role as RIA president, newly assumed this week.
Yep.
When you're talking to your counterparts in these other states, and I see that, some more states got together today to align reopening plans. Are there any unique trends or approaches you're seeing with your counterparts in other states as they prepare to sort of pivot into a different mode of thinking and economic recovery and disinfection services to be provided, or any other things?
Great question. There's a lot of discussion about it right now. The things that I've heard the most commonly, first of all, there's a lot of disagreement as to when this reopen happens. And unfortunately, it's something that's become somewhat political, and it really shouldn't be political. So I think that it's probably going to be handled state to state. Every state's going to handle it a little differently. Of course, not all states have stay-at-home orders right now. So that just shows you right there's a lot of difference. I suspect that our governor is going to take a very conservative approach, meaning that he's going to err on the side of caution. I think that's been his approach from the beginning. So I think that's how we'll be looking at this in Montana. Generally, it seems that the states that have lower density aren't having as many issues as those where there's a lot more density. And especially also the area where there's international airports with more traffic seem to have been more heavily hit. One of the things I think that a lot of people are concerned about is that there is a pretty decent likelihood that there will be problems that businesses encounter as they open their doors again. And particularly in areas where there was snow melt. I mean, there even though this was a mild winter, there still was a lot of ice damming that happened. And people haven't been in their buildings, and a lot of people, like, not even to check on anything. So there probably are going to be some issues related to mold and fungal growth in buildings, especially commercial buildings. We'll potentially see a little bit of an uptick in people that see that issue. So that's something people will need to be mindful of. And then there are some businesses that are gearing up and really trying to take precautions with disinfection, having their buildings disinfected before they reoccupy them. Now, one of the concerns I have about that is just, I'm not sure how effective that will be. And I don't ever want to be an advocate that our customers would potentially not spend their money wisely with our company just out of fear. So if they have not occupied their building for over 30 days, there's a lot of debate as to how long this virus is viable. Some people have said a few days, some people have said up to 17 days. It seems pretty clear that if no one's been in a building for a month, that it's pretty unlikely that the virus is going to be a real risk to their business. But the issue probably more likely is going to be one of public perception. And then also as they open their doors and start to have people coming in and out, they may want to take some steps there with that. Now, what's interesting is, and this is really a positive thing, is that there's kind of these two categories of businesses. You have these essential businesses, and then you have the, quote unquote, non-essential businesses. They've not seen, even though the essential businesses are still operating, still working, they're not seeing any higher incidence rates of COVID amongst the essential businesses than they are with just people even staying home. And so it doesn't seem, again, I think that's really positive. It doesn't seem that, as people go back about the business, that there's really a lot of risk there with those places, as long as people, again, I think the key is keeping those processes in place, which would mean that, of course, as we've done with our company, having good disinfection protocols daily are important. So to that end, there was actually an event today that RIA had about how do we test these buildings that we're doing work in, and how do we know that the work that we're doing is effective? And really the key is the cleaning, even more than the application of the disinfectant. So that's how people are testing for it. So if buildings and businesses do have, a heavy layer of dust that's settled throughout their business, cleaning that first is absolutely imperative if whatever disinfectant they're going to use later is going to work. So that would probably be an area where our customers would also need us, is just to get their places ready for reoccupancy.
Awesome. Thank you.
Yep. Anybody else? I always expect like 50 questions and everyone's pretty quiet. Well, folks, I hope everyone knows my email address, and I think everybody's got my phone number. If you got something, by all means, reach out, and we'll have a discussion about it. If you get new information, please share it with us. We've got lots of information from lots of people in a very difficult time, and it has been so challenging for so many people, and we're in a lot of unprecedented areas here. Sometimes we don't have the answer. Simply because these are things that we've never dealt with before. And I think when we have this all behind us, we'll be able to look back and take lessons away from this. But until then, we're just going to do our best day to day, and that's what you have our commitment for. So thanks again for everyone to what you're doing. Together, we're going to get through this tough time, and don't hesitate to reach out if you need us. Thank you so much, and have a great evening.